All right, doctor. And then just for the record, if I could just get your first, last name and your title.
This is Dr. William Schaffner, Schaff as in Frank, Ner. I'm a professor of infectious diseases at the Vanderbilt University Medical Center in Nashville, Tennessee, Music City, USA.
All right, Dr. Schaffner, thank you so much for talking to us. We appreciate your time. And just to kind of jump right into it, we're hearing this word tripledemic here. Um, what should we be, should we be worried about this? And exactly what is it?
Well, the tripledemic is referring to the fact that at the moment, there are three major winter respiratory viruses out there that are very active. Of course, number one is COVID. That's been sailing along, hasn't really upticked yet. But the other two viruses have come very, very early. For example, let's start with influenza. Influenza came 4 to 6 weeks early and began to infect people in a very vigorous way. Certainly in my neck of the woods, we're seeing a lot of flu, not only in children, but adults, and it's sending many of those persons to the hospital. The third virus is one that is abbreviated RSV. Most people haven't heard about it. Its fancy name is respiratory syncytial virus. Long thought to be exclusively a virus that affects children, particularly very young children, we now know that RSV also can affect older persons, particularly those who have underlying lung disease and heart disease. It too is a virus that usually is out there in January or February, but hello, October, November, now December, this virus has also come early and is infecting many children and quite a few adults also. So we have a tripledemic, COVID, influenza, RSV, all pretty much at the same time. Wow.
Yeah, it's definitely alarming here because you definitely need to be prepared to make sure that you don't catch anything, especially with the winter months and just the colder season. Everyone is, just kind of inside here. But talking here for our state of Nevada, we're seeing this thing called the superbug. And it's really kind of, we're seeing just an uptick here in cases, almost 800 cases, 63 deaths here. What should people know about this?
Well, this superbug is called Candida auris. It's a fungus. It belongs to a family of fungi that's usually pretty benign. This is a fungus that many of us have in our bodies and we never notice it, or it can cause in some people an inflammation of the esophagus, the feeding tube and back in the throat, and occasionally it can cause in women a vaginal infection. So usually pretty benign. But this variant, which has cropped up in several parts of the world, is more ferocious. It generally hovers around hospitals, infecting people who are otherwise already very ill and receiving antibiotics. It can be out in the environment, and when it infects these people, it can get into their bloodstream and cause other infections in organ systems. And to make the challenge even greater, it's often somewhat difficult to treat because it can be resistant to some of the antifungal drugs that we usually use. So it's challenging, and it's cropped up here in the United States starting in 2016 in hospitals here, there, and everywhere.
But there is treatment. We should mention that, right?
There is treatment. We have other antifungal agents. And when patients are infected, they are put in their private rooms in isolation, and healthcare workers wear gowns and gloves caring for them so they won't spread it to others. And there's a lot of intensive disinfection of the inanimate environment around them. So a lot of good infection control, usually coordinated with the local public health department.
All right, good information there for our viewers. All right, so jumping back a little bit, I want to go back to COVID. Talking about the boosters right now, so many people are kind of like on the fence as to whether they get the shot or not. Who should be getting them and why?
I'd like everybody to jump off the fence. Join many of us who've already been boosted. It's now recommended for everyone, get this, starting at age 5. It's an updated vaccine. We've taken the original COVID vaccine, updated it. Now we call it bivalent because we have a new component in it that's more effective against these new COVID strains, those Omicron strains that are out there. We've updated it in a way similar to the way we update the influenza vaccine each year. And in order to get the best protection over the next winter months against COVID, particularly against serious COVID, the kind that will put you in the hospital, it's recommended that you receive the booster. Ask your healthcare provider, have a conversation with them. I hope and I would anticipate they would encourage you to get vaccinated. Certainly, everyone who works in my medical center, we're all boosted.
It's always great to have that conversation going with your doctor if you have any questions, of course, because there's so many individual cases, obviously different needs there. Going back to RSV, as we're seeing that the cases are going up, you mentioned earlier a little bit about this topic, but what do you think parents need to know before they go to the ER?
Well, think about this. This is a virus that when it first infects you is usually the most severe. You can get repeated infections throughout the years. For the most part, it produces the symptoms of a bad common cold, but particularly in very young children under a couple of years of age, it can get down into their bronchial tubes, cause inflammation, those mucous membranes swell, and that causes difficulty breathing. So if your young child at this time of the year, or any time of the year really, has stopped eating, is not taking fluids, looks poorly, and particularly if they have any difficulty breathing, please take them to a healthcare provider very, very quickly. They can be taken care of. Pediatricians know how to help children through this infection, and almost all of them come out on the other side perfectly fine.
And doctor, also health officials here today, they made an announcement here that we have a code red for hospital beds, basically just over capacity here in Nevada. What does this all mean here for residents moving forward?
Well, what's happening across the country, not only in Nevada, is that these 3 viruses are really straining healthcare systems. Around here, we have lots of infection and we're working very hard, but we haven't been overwhelmed yet. It does mean that health systems have to provide longer coverage, more people out there, people are working longer, and they may have to adjust actually the sorts of patients that are admitted to hospitals for a while. For example, people who are scheduled for elective procedures may find that they have to postpone those because we need those beds for people who are acutely ill.
And then one last question, doctor, before I let you go. Just overall, just the primary way here to stay safe. Get your vaccines. I mean, are you also recommending maybe just kind of bring that mask back up, especially during the holidays when people are starting to gather here to celebrate?
Well, Christian, I'm so glad you asked, because there are some things we can do to protect ourselves, our families, and our communities. Fundamental is getting vaccinated. And I'm talking about 2 vaccines. The COVID booster, everyone 5 and older is eligible for that, and the regular seasonal influenza vaccine. Everyone 6 months of age and older is recommended to receive that. Both of those vaccines can help prevent the serious complications of those infections. And I recognize we're asking people to roll up both their sleeves, COVID and flu, but it's very important. Number 2, good hand hygiene. That RSV can get on your fingers. Then if you touch your nose or your mouth, you can infect yourself. So frequent hand hygiene. If you do become ill, contact your healthcare provider. I didn't say go, because you don't want to spread it to everyone in the waiting room, but contact them because we have treatments, particularly for COVID and for influenza, that can ameliorate the severity of those infections. And particularly for people at high risk of the complications of both these viruses, older people, people who have underlying illnesses, heart disease, lung disease, diabetes, people who are immune compromised. Dust off that mask, put it back on when you go out into crowds, and that includes the mall if you're going shopping. Social distancing may be a good idea. I know you'd like to go to all those parties, but if you really have an underlying illness, think about it twice. Maybe it's time to stream a movie rather than rent a movie.
Yeah, it's also a very good time to maybe show off that holiday spirit with the mask. You can always obviously just decorate it there. But just
Exactly.
to give a reminder here for viewers, is there a risk of getting the COVID booster shot and the flu at the same time, or do you recommend just kind of getting them uh, in different dates?
You can actually get them both at the same time, no harm, except, yes, both arms may be sore for a day or two, but other than that, there's no contraindication to getting them both at the same time. If you want to spread them out, please make an early New Year's resolution to absolutely get that second dose, because a vaccine deferred is often, unfortunately, a vaccine that was never received. So, a bird in the hand is worth two in the bush. So get them at the same time.
All right. Thank you so much, Dr. Schaffner. Thank you so much for your time. We appreciate it. Anything else that you want to add that I forgot to ask?
We're comprehensive here, Christian. Thank you.
Thank you so much. I appreciate it.